and we are an abortion care provider. So that is why I am speaking on the panel.
Thank you, Mercedes. And I will turn to Emily.
Hello again. As I said before, my name is Emily Kaufman. I'm the Associate Director of Investigative Research at the ADL Center on Extremism. And at the Center on Extremism, our team works to monitor, expose, and disrupt extremist threats, both on the ground and online. As ADL's research and investigative arm, we serve as a clearinghouse of real-time information about extremism and hate of all types, and we share our expertise and support law enforcement, the tech industry, community groups, and other constituents. And I'll stop there.
Thank you, Emily. And Nate.
Good morning, everyone. And Jamie, thanks for helping us pull this panel together. Yeah, my name is Nate Lee, and I work at the Washington State Department of Health. I serve as the Chief of Resiliency and Health Security. And a lot of the work that we do in public health as it relates to injury prevention and violence prevention really is around understanding what is happening through data, and then really thinking through what are those interventions that make the most sense to, as Cynthia pointed out in her presentation, really change the conditions that we're living in as we move forward, and doing so really improve health over time. So thanks for having me.
Thank you, Nate. And again, thank you all for joining. And Cynthia will also be popping in potentially with some follow-up questions to help us guide this discussion. But we're first going to start with Emily. So Juan had mentioned, data from the ADL that talked about Washington being ranked highly for extremist incidents. Can you just share more with the group about sort of the history as well as current examples of domestic extremism here in Washington State?
Yes, absolutely, and I won't be able to cover everything. I've got about 5 minutes here, but looking forward to questions that come from folks following, hearing from all of our awesome panelists today that aren't me. So to start, for decades, Washington has been a hub for a wide range of extremist activity. This history spans from massive public rallies organized by the Washington State KKK in the 1920s, with attendance of those rallies ranging from 20,000 to 70,000 people, to more recent events that illustrate the persistence of extremism in the state. In the 1980s, Washington gained national attention when a shootout with law enforcement on Whidbey Island resulted in the death of white supremacist terrorist leader Robert J. Matthews. This incident continues to be celebrated by many white supremacists as Martyrs' Day. And decades later, in 2023, 4 white supremacists were convicted of hate crimes for the racially motivated assault of a DJ in Linwood in 2018. Notably, according to court documents, these individuals were en route to the Seattle area to celebrate Martyrs' Day when the attack occurred. Between 2017 and 2021, Washington and the broader Pacific Northwest saw frequent street fights and street violence between the Proud Boys and anti-fascist protesters. Even more recently, Washington has seen the formation of white supremacist networks and coalitions like the Northwest Nationalist Network, which is a coalition of small white supremacist groups and networks based in the Pacific Northwest that was founded in early 2023. This coalition distributes propaganda and holds in-person demonstrations to spread their white supremacist ideology, and has also often targeted the LGBTQ+ community. By working together as a coalition, these small groups and networks bolster their propaganda distribution efforts and attendance at demonstrations. In fact, in 2023, the Northwest Nationalist Network held at least 10 demonstrations across the Pacific Northwest, making it the most active white supremacist coalition in the country that year. Now, one of the things we also do at the Center on Extremism is create and maintain data sets that can help us assess the extremist landscape at the state, regional, and national levels over time. A good data set to point to the diverse extremist landscape in Washington is a data set we've had for the past 16 years on shots fired between police and extremists. And for this data set, Washington actually differs quite a bit from the rest of the country. So since 2009, there have been 7 shootouts between extremists and police in Washington. 4 of those shootouts involved white supremacists, and 3 were between police and left-wing extremists. Nationally, dominate that count and represent the vast majority of extremists involved in shootouts with the police. Over the past decade, so looking at from 2015 to 2024 now, and over the history of this 16-year study, right-wing extremists, typically white supremacists or anti-government extremists, have been responsible for the majority, between 79 to 92% of these violent encounters with law enforcement nationwide. But in Washington, we have a situation where there's more of a balance between left-wing and right-wing extremist shootout activity specifically. In terms of other data sets, according to our annual audit of anti-Semitic incidents, Washington has seen a dramatic rise in anti-Semitic incidents in recent years. In 2023, which is our most recent complete data year, our data for 2024 will be released in the coming months. The number of anti-Semitic incidents in Washington increased by 191% from 22 levels, rising from 65 to 189 incidents. Additionally, we've seen high numbers of white supremacist events in the state, as Juan alluded to. In 2023, ADL documented 17 white supremacist events in Washington, placing it as the state with the third most white supremacist events in the country, coming in behind Texas and Ohio. We can also look at the FBI's hate crime statistics for some additional context. And according to their latest stats for 2023, there were 557 reported hate crimes in Washington, which represents a slight increase from the 132 incidents recorded in 2022. Now, this data that we and other organizations collect can give us a snapshot of extremist activity in the state. No one snapshot is telling us the whole story, but by collecting data, and this was certainly not an exhaustive list of our data sets or data sets that various other organizations and agencies put out, but by collecting this data about things like shootouts, anti-Semitic incidents, white supremacist events, and reported hate crimes, we can better understand the scope of the problems facing our communities and where resources may be best placed to address them. And I will stop there for now. So thank you.
Thank you, Emily. And I'm sure you could give, probably like Cynthia, an hour-long presentation, especially focusing on extremism here in the, Washington and broader Pacific Northwest. But we will turn to Nate. So Emily's just given kind of some great various examples of how extremism has shown up, various shootouts, and different activity across the state. Public health has also been an area that is impacted by violent extremism, but it also plays a role in preventing and responding to incidents that are rooted in extremist beliefs. Could you expand how public health is generally impacted and maybe some specific examples of where public health agencies have been targeted? And additionally, what other incidents has your office assisted in the response with?
So, yeah, as you mentioned, public health sits kind of in this interesting space as often being a responder as well as often being the recipient of different impacts on our own infrastructure. So certainly through the COVID pandemic, we saw a pretty significant increase in the number of threats against health departments, both state health departments, federal health departments, as well as threats against individual public health practitioners. And this was a space that honestly public health was a little bit unfamiliar with the exception of certainly some of the areas of human health where there are a lot of strong feelings. And I know that Mercedes is going to talk a little bit more about her clinic's experience in that space. But as we think about kind of the impact on public health, we also think about really what are the consequences of any sort of violence or even threats of violence on the mental as well as physical health of people in Washington. And so certainly in our work, one of the key things is how do we respond to these things? And so I think many are aware that over the past several years, we've seen a number of events where folks have put things in letters or ballot boxes or take your pick, where there is either a genuine threat, and it could be an incendiary device, or it could be something that's designed to mimic a biological or chemical weapon, things that are designed to actually function as potentially a biological weapon. And so our agency actually really does have the laboratory capacity to be able to test that. We do have systems in place for being able to respond to those. We work closely with the Federal Bureau of Investigation as well as state and local law enforcement agencies to understand those threats. We also play a role in responding to the consequences of these events. And so, often we are at the table really helping manage the medical surge that's required following any sort of event that has multiple casualties. We're often involved in then, and I think somebody may have flagged this on our task force, but also, really thinking through and supporting communities with the mental and behavioral health supports that they might need following either a threat or an actual event that results in human injury. So in our space, we kind of have this mix of both being a responder as well as sometimes being a target of domestic extremist violence. And in that space, we have been working law enforcement as well as some other structures to begin to understand kind of what are those spaces where one, public health can be doing a better job in the response, but more importantly, what can public health really be doing to help with that primary prevention role? As an agency, we definitely play a role in preventing disease, preventing injury. And what can we be doing collectively to really engage maybe a little bit more deeply in that area around especially extremist violence, which is a little bit different than individual violence or some of the other areas where a lot of our violence prevention activities have been focused. So turn it back over to you, Jamie.
Thank you, Nate. And now we'll hear from Mercedes. So abortion providers have been a target of domestic extremist groups. For example, here in Washington, there was a clinic in the 80s that was firebombed multiple times. Your clinic that you work at also provides services to our LGBTQ community, which is being increasingly targeted as well. So I was just wondering if you could expand on some of the issues Cedar River Clinics has faced and the impacts of this targeting as well.
So we are lucky in Washington. We have a long history of supporting reproductive rights, but I think that also gives us a false sense of security. And we have always had challenges and continue to have challenges. Our clinic started out as the Feminist Women's Health Center in 1979, and it was actually our location in Everett that was firebombed 3 times, and luckily no one was hurt, and the person was prosecuted and went to jail. And kind of through the 80s and 90s, our clinics locations were also subject to clinic blockades and intense threats and intimidation. We used to have a daycare center that had to close because of it. And also, kind of moving up to now, we are, and especially, I do want to highlight, because Cynthia highlighted this as well, the free speech thing. We recognize that there are strong emotions around abortion, and people do have the right to free speech and to protest, whether for or against, but it is when it crosses the line into those threats and intimidation and violence and terrorizing really patients and staff. And now more currently we are seeing things like bomb threats and cyber attacks as well. And I do also want to raise up as a side note, just nationally, there is definitely a crossover with white nationalism and anti-abortion groups. And, it started first as being against abortion, but as you mentioned, because our clinics offer gender affirming care for transgender and non-binary folks. And even abortion is now being brought up. And it definitely, the intensity has definitely increased after Roe v. Wade was overturned. And I think there will always be the concern and idea that we have to do more in Washington to protect patients and providers. And also, I love the community health idea because the groups we're being targeted by often are not based in Washington. They're based in other states or have leadership in other states such as Texas and Idaho. And I think there's a radicalization that's also happening in recruitment in Washington. So it is definitely, there are things within the strategies we have to look at in how we're being targeted and by who, as well as our response to it, both in prevention and in security.
Thank you, Mercedes, for those examples, and thank you all. I realize that does not cover, the extent to which extremism has shown up in Washington State or continues to show up in Washington State, but we unfortunately don't have, an unlimited time, so we're gonna kind of move on into a little bit of a conversation about connecting public health and community-based frameworks to this issue. So I'm actually gonna turn back to Nate. So public health approaches focus on promoting quality of life and building connected and cohesive communities. Can you talk about the nexus between a public health approach and combating extremism? And are you aware of any state level programs that you think would fall within this public health framework for addressing violent extremism that currently exists?
Yeah, so when we think about the public health approach, fundamentally, we're kind of talking about like a 4-part process where we really work to identify what the problem is. We identify the risk factors associated with the public health issue. We develop some prevention strategies, and then we implement those and really evaluate how well they work. When we think about like the public health model, whether we're dealing with communicable diseases or whether we're dealing with violent extremism, this is essentially the idea. As we think about how that rolls out, often what we find is that there are a number of fundamental structural, social, societal pieces that come into play that contribute to a lot of ill health. And I want to say that, when we think about health from a public health perspective, we often aren't talking necessarily about the absence of disease. We're really talking about quality of life. We're talking about people being able to feel safe in their communities. We're talking about people being able to really live their best lives. And that's what public health is really about. In there, as we start to look at those social determinants, those structural determinants of good or poor health, we start to realize in a lot of cases that the same kinds of interventions support health in many different ways. And when we think about this idea of really community health or improving the health of a community, that's a little bit different than improving the health of an individual. Most of us have probably heard the standard public health messages around good hygiene, around good nutrition, around moving regularly, around developing a mindfulness practice of our own. All of these things really do help us as individuals. When we think at the community level, we almost have to think about those same basic ideas, but now, do we have those spaces for people to gather? Do we have those spaces for people to experience health? And so often when we get into that level of community health work, we're addressing chronic disease issues, we're addressing communicable disease issues, we're addressing issues around injuries and violence with the same basic set. The key is kind of, again, back to that 4-step process, really being able to define a little bit what the problem is, the problem statement, and being able to get the data to understand how that's playing out. And then from there, working back to understand what are those underlying or root causes that are driving some of that. So, when I kind of been thinking about your question about what are some of the programs that we have that in public health across the state that help address some of this, and the answer is we have a lot of programs that are really working to address some of those fundamental social determinants, those structural determinants of health in many of our communities across the state. And so I think the question might be, how do we adapt those or expand those or adjust those in order to also really encompass how we're addressing violent extremism, violence, and injury? Because fundamentally 1,600 people a year in Washington on average do either die or become ill from injuries. We know that this is I think it's the 8th leading cause of death in Washington state. So it's a priority. And in that, and I'd love to get Cynthia's take on this, and this was going to be my question earlier, but from a public health perspective, we really do believe that all violence and all injuries are A, predictable, and B, preventable. And so by figuring out where in that chain of events we can see that this is happening and actually begin to help change the course of that, this is what we're seeking to do in public health. The other thing I would just add in is that when we think about especially injury and violence prevention, we have actually seen largely over the last 30 years a really significant improvement in people's safety, in people's ability to make really good choices that keep those things from happening. And I think somebody mentioned proving a negative is often very difficult, right? And so the last little thing I'll throw in is that public health often looks at these things over a little longer period of time. When we're working to prevent cancer, that can take many, many years to develop. The things that prevent cancer have to happen very early in somebody's life, right? The same is true at the community level when we think about things like violent extremism. A lot of those interventions have to happen early on, and over time, we start to see really that reduction come back down. So this is to say that often public health interventions are in it for a longer haul and often require a little bit more length of time to really begin to see the impact of those interventions. So
you, Nate, for that. And I'm sure Cynthia will be able to get to your question after we come back from public comment. But we'll turn to Mercedes. You mentioned, impacts not only you serve, both staff and the people who are coming to get services at your clinic are facing some of these conditions. When we are thinking about a community-based framework to address this issue, we also need to consider how we ensure that workers who are both targets and work with those who are targeted, similar to, Nate's field as well, the nexus between public health being a target and also assisting those who are. We need to make sure that those groups are supported and resourced. So could you just talk a little bit about the importance of supporting and resourcing our community-based service providers who are in sort of this area of being a target, and also supporting those who are targets of extremist groups?
Well, I think there are many different ways we do it now, which are all pretty reactive. Like, it's all about training people, and we have worked with federal, state, local agencies to train staff. And we do things like security assessments, and at a point it becomes the reaction of needing security. So we're a nonprofit organization, and many of those targeted are. So it's always important to have funding so that we can have security. as well as have trainings for staff. And I think it's also a community issue because it is, of course, our patients and staff that are being targeted. But when we have very intimidating and threatening groups picketing us, for example, it's also our neighbors being impacted as well, both depending on the location, both residential and other businesses. So I think it's a community issue, which also, again, brings in that community health issue that I think is helpful as well, because there's what we have currently now, and hopefully what we can address that will impact the future.
Thank you, Mercedes. And then we'll turn to Emily for just one last question. I recognize, this is nowhere near the amount of time we could have to discuss these things. And I'm sure there are many members also that could speak to different experiences here in Washington State, how it shows up, and also the connections between their orgs and the work they do with this public health framework. So we'll have time to continue this, but we'll turn to Emily for kind of one last question before we have some final thoughts. And Cynthia, if you have any follow-up questions, then we can get to those as well. But Emily, you talked a lot about the data sets that ADL collects, and Nate talked about the importance of using data to inform strategies. So can you also share a little bit more about why it is important to have data and information when it comes to combating extremism, and how does ADL use the data that they collect to inform current policy and legislation now?
Sure. So, accurate and comprehensive data allows organizations like ADL, but of course other organizations doing similar work to monitor trends, to identify emerging threats, and provide actionable intelligence to law enforcement, policymakers, and the public. And so, by gathering and analyzing data from online platforms, extremist literature, and through the direct monitoring of extremist groups, we can track the evolution of extremist ideologies, recruitment efforts, and networks, and all of these different groups that fuel hate and violence. And this information is really vital for several reasons. First, it helps us to identify patterns and threats, right? Data collection helps us detect shifts in extremist activity, like things like increases in anti-Semitic rhetoric, hate crimes, or extremist campaigns targeting specific communities. Secondly, it's crucial for public awareness. By sharing findings through reports and advisories to the public, we aim to educate communities about potential threats and how they can best respond to them. Thirdly, it allows us to support law enforcement in their efforts to mitigate hate and bias-related crimes. We provide, as I mentioned before, intelligence and training to law enforcement agencies to help them understand key information about different extremist groups, and also to assist by identifying potential violent threats and elevating that information to them. And lastly, accurate data also helps us to counter misinformation, right? By debunking false narratives and ensuring discussions about extremism are based on evidence. Now, what we do with this data, right, how we leverage it. So ADL leverages this, extensive data we collect on extremism to advocate for effective policies and legislation. This process involves policy recommendations, such as advocating for policies to support better reporting mechanisms for hate incidents. We also advocate for technology regulation, for reforms to social media platforms to promote things like content moderation and requirements for algorithms that amplify extremist content. It also includes briefing policymakers on trends in extremism, providing data-driven insights to help shape legislation that addresses these current threats. And lastly, and I think most importantly for this group, through building coalitions, we work with other advocacy groups and community organizations to ensure that legislative proposals are inclusive and effective in addressing the root causes of extremism. And I think it's just been so great to hear from folks on the public health approach and the de-radicalization elements, which are, not something that is a part of our everyday work. We actually refer folks to Parents for Peace when they're talking about de-radicalization. So really a lot of different folks contributing to this really important fight to combat extremism. And I will stop there.
Thank you, Emily. And now I will turn it to Cynthia. If you have any kind of follow-up questions for our panelists before we let them provide maybe some final thoughts and close this section of the agenda?
Sure. I would ask, I guess I want to respond very quickly to something that Nate said about the framework for public health and how important it is when we're looking at the prevention of violent extremism, that we're looking at some of these same types of factors. And I think Nate put it really nicely in talking about this idea of sort of predictive factors, risk factors, and protective factors. And that often in the field of preventing violent extremism, we've really only looked at the risks and not enough at these kinds of, are really about how you build better social well-being. How do you, and a part of a public health approach is supposed to strengthen those protective factors, not just reduce the risk, right? And so if we're only thinking about reducing risk, that's sort of, I often say, like, I don't really want to live in a world where our best measure of violence prevention is how good we've become at barricading the doors, right? Like it is an important thing to do, to teach synagogues to lock the doors before service begins. But like that can't be all there is, right? And so a public health approach is saying, okay, yes, we do need to have some of those risk factors and some of the evaluation of those types of things, build better barriers, but that's not really a comprehensive approach to better social and community well-being that includes the reduction of violence on the back end. And so I think when we think about reducing, risk and strengthening the protective factors, we're looking at things like reducing social isolation, creating better communities, creating better trust across communities. And those are all measurable things. So back to the kind of, how do you measure this? You also can look at, are people feeling more connected? Do they feel less isolated? How many friendships do they have? Are they feeling a better sense of trust in their community, in their neighbors, in their institutions? And those are all things that we know are associated with reduction of risk of violence. And so there are other ways to measure this that I think that we can talk about as we move forward in the task force as well. So I guess the question I would throw back if we have time is, like, for anyone on the panel, what would a good factor look like for you? So when we're looking at, like, what do you think, when I say social well-being, in the worlds that you work in, what is an ideal scenario in terms of improved protective factors for a community?
Happy to step out there into this one. I think there's a couple of pieces to that when I think about just overall community protective factors. And one of them really is social cohesion and social capital. This is, I think, a really tricky time in our country where we've seen over the last couple decades a significant decline in engagement in civic processes, engagement in community organizations, engagement in a lot of things, right? And I do feel that just simple engagement in the community is one of those things that really is a significant protective factor. Again, not just for violence and injury, but for a myriad of different health issues. So, I think that's a key piece. That said, I do feel that we're in this space right now where there's a certain amount of incivility in society that's really contributing kind of to that I wouldn't say resistance, but maybe that less willingness to really be engaged in community in a meaningful way. Because as you do that, you really do have to take that step back and accept that there are a lot of different viewpoints that are out there, and some of them may be uncomfortable, but it's through that engagement that you can really build that sense of community regardless of some of the different viewpoints, right?
Mercedes or Emily, do you want to step in and answer?
Sure, I'm happy. I'm sorry, Mercedes. I can't see if you're saying something, so apologies if I'm talking over you. Feel free to hop in. I just wanted to. This was just making me think about rights. I think what you were saying about community connection being so important, and I think it's important for us to understand that some folks who are coming to these really dark places on the internet or on the ground are doing so because they are seeking community and they feel isolated, right? And they wind up in online spaces spaces where radicalization can take place very quickly. And I think we've recently seen, young people who their ideologies might not be particularly sophisticated. They are familiar with white supremacist writings, for example, but they have this kind of fascination with violence that has come from being exposed to that kind of content that is a motivating factor for terrible acts and things like that. So I think that something I've thought a lot about in looking at and monitoring and tracking extremism is what we can do to protect folks and inform folks from being exposed to even more extreme content than they were planning on, and engaging with when they are going into these online spaces with low to no moderation. I'm talking more about things like Telegram now, right, which is an encrypted social media messaging platform with really limited little to no moderation. So I think it's just important to think about the changing nature of extremism and how online folks are and what we can do to support folks who are isolated and might be seeking community in some of these spaces to help them recognize the dangers of kind of going down those paths and what some of those what some better outcomes could look like rather than pursuing those. So.
That is a huge question, Cynthia. And, I keep going back to everything we're doing, and even to some extent with this, it's all very reactive to things that are already happening. So, pie in the sky, I think we need to have a whole variety in many areas of changing our culture and society, which is a big, huge ask, right? Because it's not only societal, cultural, religious, but also economical. Like that can't be ignored as well. When people are struggling, it is, I think, an easier way to be radicalized. So, this will be a strange, hopeful comment, but we have to make it all better.
No, I appreciate your pie in the sky. I hope everyone here has their pie in the sky version as well. Well, we do have just a couple minutes here left for our panelists to share any kind of last final thoughts they have with the group, recognizing this doesn't have to also be your final thoughts. There's opportunities for more discussion always on this topic. So, Nate, do you have any kind of final thoughts for the group for this first conversation on extremism here in Washington? Oh, and you're on mute.
Again, as long as we've been on Zoom, you'd think we'd have this worked out. No, I'll piggyback a little bit on what Mercedes just said. And, I think there is that space where a lot of times we put a lot of energy towards reacting. And reacting is very expensive. It's very time consuming. It's very energy consuming. And being proactive and really thinking about primary prevention is often a way to approach this in a very proactive way. I'd also just leave it with this, that typically when you look at the return on investment for prevention activities, especially in that primary prevention space, the return on investment is usually really good. It's a worthwhile endeavor. And to Cynthia's point, it's also hard to prove a negative. So, I'll leave it there, but I just love this idea of proactivity and primary prevention.
Thank you, Nate. And Mercedes, any last final thoughts for the group?
I do, kind of going back to what Cynthia said about the us versus them mentality of groups when they're radicalizing. I think when we're working on solutions, we also have to be careful of that idea.
Yes, thank you. And
I'm sorry, can I ask you to elaborate a little on that? What do you need
That
to be
it's an
careful
us
about?
versus them.
That we're not slipping into that.
Yes.
Okay, thank you.
so for people who might not have heard, it was so we don't slip into the us versus them. And Emily, last thoughts.
Sure. I think, first of all, I'm really grateful to be part of this task force, which I think is taking a really important and holistic approach to what is a really challenging problem. I think what I talked about a little bit today is the kind of the complexities of the extremist landscape in Washington, but I want to highlight that there have been some serious through lines, right? White supremacy is a significant problem, and in Washington, we just happen to see kind of clashes between right and left, perhaps a little bit more than we do in other places, but each of those statistics I shared really can't be taken in isolation, and it's really important to consider a holistic picture of extremist activity in Washington. I think by hearing from all of the different folks on this task force. So no, I just really appreciate the opportunity to share a little bit of information there, and I'm just grateful to be learning myself about the public health approach that I think is really uniquely important to this issue, to fighting this issue. Thank you.
Thank you, Emily. And thank you all for joining this first panel. I really appreciate you being willing to share your experiences with the task force, for meeting with me beforehand to help make sure this, conversation was productive. So again, just thank you all for your time. We are now going to move into our public comment period. So I just want to thank the members of the public who have joined both in person and online today. We will, as a reminder, registration did close for public comment at 5 p.m. last evening, and comments must be related to items on today's agenda. We received 4 written comments before registration closed, and those were distributed to the task force prior to the meeting. We have 10 people signed up today for verbal testimony, and we'll be going in order of the way we got people registered. As we call on you, please state your name and the agenda item you are commenting on. For those who are joining us remotely, once we call on you, your microphone will be enabled for you to speak, and we'll be having a timer running so that it can help manage time for people today. So I'm gonna start with Linda, who's joining us here in the room, but then we'll be going to Erica Engelhardt and Shannon Zimmerly, who should be joining us remotely. So I will put you up all on deck for going next. But Linda, if you would like, it might be easiest to stand and maybe take a step closer so that everyone can hear you. If you're comfortable, or for everyone, if you're comfortable.
Okay. I have just some things that I brought, so
Oh, yeah.
I want to talk about, if that's okay. So, yes, I came down here because I'm concerned about, number one, the task force. I don't see the task force having anybody that doesn't agree with the task force. So that is one of my concerns. Another one of my concerns is I followed Cynthia, and I read, her book, and just watched her on podcast, watched her on CBS with whatever her name is, and her 3 main things that she keeps saying that are her biggest concerns are religion, gender, and sexual orientation. And I have a problem with that being her 3 main concerns. Number one is because religion, depending on, what it is, it can be good, right? Obviously. I'm a chaplain. I work in the jail and the prison. And so I'm pretty familiar with, everybody's circumstances and how they got there. It's very important for us to keep that in mind. Another thing too is that, we're talking about religion, and here we've got, white supremacy is sort of like a religion right now to the left. And
Thank you, Linda. We're sorry that's all about the time that we're able to provide today. Thank you for your comment. So we'll be moving on to Erica Engelhardt, and you should have your microphone enabled now.
Okay, can you hear me?
Yes, we can hear you, Erica.
Okay, so my concern is, well, first I want to say I think the public health approach is a little bit of a stretch for the issues that are being discussed here. And I worry that it's going to start kind of stepping on people's rights a little bit, because we already know the Secretary of State is monitoring social media for misinformation, and I feel this is kind of leading in the same direction, which would then suppress free speech. People will be afraid to speak out if they don't agree. Criticism leads to innovation. So we don't want to close that door for people to be able to speak out in disagreement or whatever that may be. And I also believe that real violent threats should be addressed by law enforcement. I think we should let them do their job. They're trained for that kind of thing. And I don't know that this task force is really equipped to be able to address those kind of situations. And I just, want to make sure that people.
Erica, that's all the time we have this morning. We'll be moving on to Shannon Zimmerly. It doesn't look like Shannon is currently on the call, so we'll come back to her at the end if she's been able to join. Next, we're going to go forth with Lisa Templeton, then Sulani Madsen, and Diane Gruber will be on deck. So, Lisa, your microphone should be enabled now.
Thank you. 60 seconds. No reasonable person disagrees that unprovoked violence is acceptable. However, domestic extremism has not been defined in Washington statute, and previous discussions here indicate that it includes making statements that some disparagingly label as propaganda or misinformation. These activities are not unlawful. Quite the contrary, the First Amendment rests on the assumption that the widest dissemination of information from diverse and antagonistic sources is essential to public health. People like me, who have no intention of using violence or intimidation, are deeply concerned that we will nonetheless be branded extremists when we speak our minds, and this is frightening. It does not feel safe at all. Task force members, please focus on utilizing existing law to quell violent acts. Targeting non-threatening people who assert their right to free speech constitutes an abuse of power. I'm Lisa Templeton from Informed Choice, Washington. Thank you for hearing my comment today.
Thank you, Lisa. And now we'll be moving on to Sulani. Your microphone should be enabled now, and you'll be given 1 minute.
Okay, I'm Sulani Madsen. I wear a lot of hats. Most relevant today is that I am a co-leader of Braver Angels, an organization that is dedicated to bringing greater civility, but I am speaking as a private citizen. And I would like to point out Braver Angels approaches this by making sure that at every level of leadership, we are balanced. I have a co-leader who is blue leading. I'm from the red leading side of the spectrum. And several other commenters have already spoken to that. Lack of perceived balance, which is going to affect the effectiveness of this task force. I would like to bring to your attention today a conversation I had online because the Brave Angels Way says there's no one not worth listening to. I do connect with a lot of left-leaning folks on social media, and I had someone tell me that after posting a plea for civility and to push back on vigilantism after the killing of the United Healthcare CEO, someone who posted a significant threat on X, and I have no idea what to do with that. He said self-defense isn't violent extremism, it's the correct moral choice. He claimed that it was a self-defense killing of Brian Thompson.
The time we're able to allot to you this morning. We appreciate your comment. We're moving on to Diane Gruber. Your microphone should be enabled now.
Okay, can you hear me?
Yes, we can hear you.
Okay, good morning. Your task force is supposed to be making recommendation to the legislature to establish a public health and based framework to combat extremism and mass violence. Well, I'm really confused because Black Lives Matter by far has created the most mass violence across America over these last 10 years than any other terrorist group. Indeed, other than 9/11, BLM has murdered more people than any other organized group in my lifetime. Nevertheless, you have seen fit to place the head of Black Lives Matter Seattle King County, Katrina Marie Johnson, on this task force. Her mere presence makes this task force.
Diane, for your comment, we don't allow comments on individual characters. They must be related to items on the agenda. So if you would like to make a comment on the agenda, we can provide you an additional 20 seconds as I took some of your time, but comments are to be pertinent to the agenda. Your microphone is enabled to speak if you would like to use your remaining time to make a comment about the agenda. Okay, it does not seem like you want to continue with your comment on the agenda item, so we appreciate your time this morning, Diane. Next on deck, we have Gary Stump, Tim Iman, Sharon Damoff. I apologize if I mispronounce your last name, and Lori Lane will be our last public comment, and then we'll see if Shannon was able to join. Do we have Gary Stump? Okay, we'll see if he joins by the end of the time. Next, then we'll have Tim Iman. Your microphone should be enabled now.
Can you hear me now?
Yes, we can.
Very good. My name is Tim Iman from Bellevue, and the way you're treating the people who are making public comment is a perfect metaphor for why everyone really opposes this entire task force in the first place. When someone tries to criticize anything about you, their time is cut off. When they actually name your name, they're cut off. They're not allowed to talk. They're not allowed to speak. That is exactly the concern about this task force. The government saying you can say certain things, but you can't say other things. You can say something about one person, but you can't say it about another person. We're very concerned about.
And I'd like to remind you that comments are supposed to be about agenda items. You have an additional 20 seconds if you would like to make a comment about the agenda as stated on our registration portal online as well.
May I continue?
Yes, you can continue. You have 20 seconds left.
You're talking about specifically on the agenda, everything that's happening in Washington State. What's happening in Washington State is this meeting right now, and you're not letting people talk. You're mandating and cutting off what people are saying, their criticisms, and that is the thing that is so dangerous and why this entire task force is awful.
Thank you for your comment, Tim. And now we'll be moving on to Sharon. Your microphone. Yeah, demo. Your microphone should be enabled now.
Thank you. Sharon Damoff, you mentioned us versus them thinking. The only way around that is to have diverse voices, but I am concerned about how lopsided this task force is. The vast majority of the members are on the political left, and people are usually reluctant to call out bad behavior from their own side of the political spectrum. But much of the active violence and hate crimes today come from the left. Antifa and BLM riots with widespread property damage, anti-Semitic vandalism and chants for the genocide of Jews on campuses and other places, violent attacks against pro-life centers, including smashed windows and threats spray painted on buildings. At least 2 members of this task force represent abortion facilities. But is there a pro-life rep? Given the multiple violent attacks on pro-life centers in Washington, there certainly should be. When a task force is so unbalanced, it loses credibility and is not likely to produce unbiased recommendations. The membership needs to be more balanced to have legitimacy. Thank you.
Thank you, Sharon. And last is Lori Lane, and then we'll see if the other 2 have joined.
And please make sure that your Zoom names match with the names that you signed up with so we can enable the microphone.
In case anyone might have joined via a different email this morning or a phone number. We'll just give another moment in case Lori Lane, Gary Stump, or Shannon Zimmerly are able to join and get their names so that staff can recognize them. Okay. Thank you so much for the members of the public who joined and provided testimony this morning. As a reminder for those who are listening in and would like to provide comment at our following meetings, we do have a registration portal. The portal is open after task force agendas are posted on the website, and the portal will close 5 p.m. before the task force, 5 p.m. the evening before each task force meeting. And you can submit both registration to sign up to speak verbal testimony, like we have seen here today, or the opportunity to submit written testimony, which I mentioned was distributed to task force members prior to the meeting.
Erica, it said we had 2 minutes. We still have 5 minutes.
due to the number of people that were registered,
That's only 3, we still have 2 extra minutes.
Yes, I know, but we were
Okay.
expecting additional people, and so we allotted time amounted to how many people we were expecting today. But at this time, we're gonna continue to move on with our agenda.
But you get to use it if they're not here?
No, I'm sorry, but we allotted 1 minute to each person.
It said online.
It says up to 2 minutes
Right.
online, and we
And we still
emailed
have 5
everyone.
minutes.
I hear you. We emailed everyone last night who registered to let them know that they had 1 minute to speak. And just because we had individuals not show up to make a comment, that does not mean we change how much allotted time we provide. It says that on our website. So if you'd like to check on the registration instructions, it shows that members are provided up to 2 minutes, but depending on the number of people who sign up, we can shorten that time. And we provided information to members of the public who had registered last night with the time that they were allotted. But now I'm going to move on with the agenda. If you have questions for staff, I can ask or I can answer them after or online via our email.
I thought public comment was why we came here. I'm sorry. I guess I just missed.
I'm gonna have Amanda.
I'm the only person here that's talking.
Okay.
So.
I'm gonna have Amanda speak with you.
We encourage her to submit comments.
Amanda will. So we're gonna take about the next 30 minutes before we close out the meeting. To follow up on the discussions and questions that we had. I'm sorry, we're actually gonna just take a 5-minute break so that we can get everything ready here in the room. And then we'll come back at 11 o'clock Pacific Standard Time. Thank you, everyone.